I started my career in Sweden, and at those times when we started education in cardiology, the standards of care were really not adequate in Sweden. So going back, I should have traveled abroad already earlier. I should have had better training in cardiology technology, probably gone to the US, maybe gone to Australia or Canada or somewhere where a cardiologist was allowed to perform coronary procedures. We were not allowed to do that in my country. To perform echocardiography, we were not allowed to do that because that was done by a clinical physiologist, so we had poor training. We were definitely not allowed to do PCI procedures. It was in the hands of the radiologist. So it was a completely different world, and therefore our education was unfortunately not adequate, and it took a certain time, and I was in the center of developing this, but I had no appropriate education to do it, but I pushed for it, and there were great challenges in changing the way healthcare was designed in Sweden at those times. So that would have been different. I would also think should have gone earlier as a research fellow also abroad, to have had higher standards of research earlier. I mean, we reached the levels of New England Journal of Medicine, circulation, etc., at a too late stage in the 1990s. It could have been much earlier if we had had better training.